This section reviews the table of contents of the Good.Pharmabook. Chapter 1 starts out by setting the scene. We look at a number of strategic drivers of change in the industry, but we also identify a few drivers that a lot of analysts talk about we think will not dramatically change the industry. Chapter 2 then looks at various opportunities for delivering sales growth. We actually look at 5 different opportunities and describe how a company can drive growth. Chapter 3 then looks at positioning our brands. We use concepts such as points of differentiation, points of inferiority, points of superiority to illustrate how a positioning can well be done. Chapter 4 looks at generating insights of various stakeholders. We challenge the use of traditional market research to really generate insights. Chapters 5 and 6 are all about competitive strategy. Chapter 5 will talk about how to make a launch successful, whereas Chapter 6 focuses on how one should approach the defense of a leadership brand. Chapter 7 looks at portfolio resource allocation. We start out with a review of the relatively traditional models, but then develop an approach which is really in tune with one of the challenging problems that pharma managers have today. The general portfolio models tend to be strategically interesting, giving you insights such as invest here or invest there. But managers also have to deal with the daily reality of achieving sales budgets. And we combine a short-term and a long-term approach on this particular chapter. Chapter 8 starts out with the tactical part of the whole book. And the first chapter looks at how one should design a marketing mix. We look at the advantages of using what is called best practice analysis, but we also review a few of the major drawbacks of taking this approach. And the preferred approach for us is to use a model that we call the hierarchy of prescription effect, where we understand which stage in their decision-making process the customer is in, and then we select a number of tactics to address the changing of the beliefs and behaviors of the prescriber in order to get to the next stage of adoption. We then expand this model to look at the various stakeholders, which clearly is one of the key strategic changes which we see in the pharmaceutical industry. And we'll also look at a way to try to understand what is the cost effectiveness of the various tactics, hence improving the return on investment of the tactical plan. Clearly, the numbers of reps are declining a bit in developed markets. They're still growing in the emerging markets. And some people believe that reps is a model of the past. We don't really think so, and we look at Salesforce management as being one of the areas to improve the effectiveness. Clearly, one of the challenges is as we move from a primary care market to a specialty care market, accounts will become much more important. So we devote Chapter 10 to account management. We look at what it is, what the various stages are, how it can be implemented, and also demonstrate an example. Certainly one of the key changes in the industry is the fact that payers have become more important. So Chapter 11 is devoted to market access. And it has actually a number of chapters inside this chapter. First, it looks at the various healthcare systems, the differences. Then it looks at the torture tools that payers use to limit expense in their particular systems. It looks at the tools that pharmaceutical companies can use to address those particular torture tools. We look also in depth at a number of different steps in the health economic analysis and different types of health economic analysis and how these should be translated to messages. And the final part of the market access chapter is a section on pricing. Clearly in the past we used to use a price per vial, price per tablet. There are many different new pricing models such as capping, such as risk sharing, etc., which start to exist. And the very final chapter, Chapter 12, is actually a case study. It looks at a product called Iressa from AstraZeneca, which is prescribed in lung cancer in both the Chinese and the Brazilian markets.